Dear viewers, Tobacco is a two-part series in Prescribon medical education series, Tobacco. This video is part 1 in the series. See related videos, two-part series on basic facts on respiratory system and three-part series on tobacco-related diseases in Prescribon medical education series. Introduction. The use of tobacco leaf to create and satisfy nicotine addiction was introduced to Columbus by Native Americans and spread rapidly to Europe. Use of tobacco as cigarettes, however, only became popular in the 20th century and so is a modern phenomenon, as is the epidemic of disease caused by this form of tobacco use. Unburned cured tobacco used orally contains nicotine, carcinogens, and other toxicants capable of causing gum disease, oral and pancreatic cancers, and an increase in the risk of heart disease. Tobacco smoke contains a complex mixture of 7,000 chemicals, more than 60 of which have been defined as carcinogens. Tobacco smoke is composed of a fine aerosol and a vapor phase. The aerosol is of a size range that results in deposition in the airways and alveolar surfaces of the lungs. The aggregate of particulate matter, after subtracting nicotine and moisture, is referred to as tar. The alkalinity of smoke from blends of tobacco used for pipes and cigars allows sufficient absorption of nicotine across the oral mucosa to satisfy the smoker's need for this drug. Therefore, those who smoke pipes and cigars exclusively tend not to inhale the smoke into the lung, confining the toxic and carcinogenic exposure and the increased rates of disease largely to the upper airway. The acidity of smoke generated by the tobacco used in cigarettes dramatically reduces absorption of nicotine in the mouth, necessitating inhalation of the smoke into the larger surface of the lungs in order to absorb quantities of nicotine sufficient to satisfy the smoker's addiction. The shift to using tobacco as cigarettes, with resultant increased deposition and absorption of smoke in the lung, has created the epidemic of heart disease, lung disease, and lung cancer that dominates the current disease manifestations of tobacco use. The rapidly rising smoking rate observed in the developing world is of concern. Dear listeners, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions, available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. World burden of tobacco use. Tobacco use is the most preventable cause of death in the world. More than 1.3 billion people use tobacco worldwide. India alone has 275 million users. Numbers expected to decrease up to 1.1 billion users by 2025. 5 trillion cigarettes smoked globally in 2014. More than 80% use occurred in low and middle income countries. The use of tobacco products among children and women is increasing. Worldwide, two-thirds of smokers live in 10 countries, led by China, which accounts for nearly 30%, and India, with about 10%, followed by Indonesia, Russia, the United States, Japan, Brazil, Bangladesh, Germany, and Turkey. More disturbing, the world's most populous country, China, has become the world's largest producer and consumer of cigarettes. China has approximately 350 million smokers who, in aggregate, consume about 33% of all cigarettes smoked worldwide. It is estimated that more than 1 million people in China die each year of smoking related diseases. This rate is projected to rise to 8 million deaths each year by 2050. Tobacco kills more than 8 million people each year. More than 7 million of those deaths are the result of direct tobacco use. Around 1.2 million deaths are the result of non smokers being exposed to second hand smoke. If current trends continue unabated, tobacco will cause more than 1 billion deaths during the 21st century. Some of the highest tobacco use now occurs in the eastern and Pacific region. Tobacco related cancer. Global burden 14 million new cases, 8.2 million deaths. India 2.5 million cancer cases, 35 to 64 years age group. Tobacco contributes to 40% of cancer deaths. Tobacco related cancers, commonest is lung cancer, followed by oral and esophageal cancer. India, 1 in 17 males and 1 in 50 females have a lifetime risk of tobacco related cancers. More than 480,000 individuals die prematurely each year in the United States from cigarette use. One third of these due to lung cancer. Indeed, tobacco is the leading exogenous cause of human cancers, including 90% of lung cancers. More than 10 times as many people in the United States have died as a result of cigarette smoking than have died in all the wars fought by the United States in its entire history. Approximately 40,000 cigarette smokers will die prematurely due to cigarette smoking unless they are able to quit. Estimates show smoking increases the risk for coronary heart disease by 2 to 4 times, for stroke by 2 to 4 times, of men developing cancer by 25 times, of women developing lung cancer by 25.7 times. Nicotine, an alkaloid present in tobacco leaves, is strongly addictive. Nicotine binds to nicotinic acetylcholine receptors in the brain and stimulates the release of catecholamines from sympathetic neurons. This activity is responsible for the acute effects of smoking, such as the increase in heart rate and blood pressure and the elevation in cardiac contractility and output. Recent studies indicate that in addition to being addictive, nicotine has other untoward effects. These include effects on the fetus, as nicotine exposure affects fetal brain development and contributes to preterm birth and stillbirth. The major diseases caused by cigarette smoking: lung cancer, coronary heart disease, that is due to atherosclerosis of the coronary arteries supplying the heart, cerebrovascular diseases, atherosclerosis of the cerebral or brain vessels, other vascular diseases, chronic obstructive pulmonary disease, that is COPD, cancers of the larynx, lip, oral cavity, esophagus, bladder, kidney, pancreas, stomach, liver, colorectal, cervix, that is front portion of uterus, and acute myeloid leukemia. Note: chronic obstructive pulmonary disease, that is COPD, is a chronic inflammatory lung disease causing obstruction of airflow from the lungs. Symptoms include breathing difficulty, cough, mucus, that is sputum production, and wheezing. Acute myeloid leukemia, that is AML, is the most common leukemia cancer of blood cells among the adult population and accounts for about 80% of all cases. It is characterized by abnormally increased multiplication of immature blast cells in the peripheral blood and bone marrow, resulting in ineffective red blood cell production and failure of bone marrow to produce mature blood cells. Cardiovascular disease. Cigarette smokers are more likely than non smokers to develop both large vessel atherosclerosis and small vessel disease. In addition to its role in promoting atherosclerosis, cigarette smoking also increases the likelihood of myocardial infarction and sudden cardiac death by promoting platelet aggregation and vascular occlusion. Stoppage of smoking has substantial benefits for those who have survived a first myocardial infarction. Conversely, for those patients who continue to smoke following coronary vessel bypass surgery for cardiac or peripheral vascular disease, the possibility of obstruction of the grafted artery is high. Cessation of cigarette smoking reduces the risk of a second coronary event within 6 to 12 months. Among those with no prior cardiovascular history, rates of first myocardial infarction and death from coronary artery disease decline within 2 to 4 years following cessation of smoking. It takes 15 years of stopping smoking for the risk of a myocardial infarction or death from coronary heart disease in former smokers to achieve the risk possibility to become normal, that is similar to non-smokers. Dear viewers, this is the end of part 1 of this two-part series. For the other video, see Prescribon Medical Education Series, Tobacco.